About 4 to 5% of adults have ADHD, but many of these people actually don't know that they have it. And there are different reasons to explain this. For example, ADHD begins during childhood. And it's possible, and in fact, it's not unusual for the condition to have remained undiagnosed throughout childhood and adolescence, either because people weren't as aware as we are today about the condition, and they may have thought, for example, that a child is just lazy, which of course was not the case. Or it may be because the condition was just not severe enough to draw all that much attention. So another reason is that many people live a great life and they have a lot of success professionally despite their ADHD. And this is important to remember. There are certainly milder and more moderate forms of ADHD. Sometimes they don't really get in the way of enjoying life, and they're in fact much closer to what we could call a personality trait, for lack of a better term. Someone, for example, who might be a bit dreamy, someone who tends to be scattered, have many thoughts at once, and so on and so forth. So in these cases, slapping an ADHD diagnosis or a label onto the person probably won't be of much help. And you could very well leave that person without a treatment and most certainly without medication, and it would be absolutely perfectly fine. Now, everyone is talking about ADHD these days, and professionals and non-professionals tend to see it everywhere, which sometimes may lead to treatments that are just too intense given the lack of severity of the condition. If you can manage just fine, if you have no significant problems with friends or at work, then you shouldn't feel pressured into looking for clinical services. But if your condition gets in the way of you enjoying life, enjoying friendships, doing well at school or at work, then you might want to consider getting assessed for ADHD. Well, symptoms of ADHD include, for example, trouble concentrating or focusing, trouble adapting quickly to change, being disorganized, having trouble managing stress, having trouble completing tasks or tolerating frustration, feeling restless, being impulsive, or having frequent mood swings. So now you'll notice that these symptoms, when you take them individually, are not in any way unique. We can all have, and in fact we all do have, days when we have trouble focusing, days when we have trouble dealing with stress, or when we feel restless. So that's not ADHD, that's just normal life. Now, another point to keep in mind is that these symptoms are also not spectacular in the sense that they wouldn't necessarily make someone stand out and seem to be different from others around them. So again, it's all a matter of severity. If your symptoms lead to suffering, either because you suffer or because others around you suffer, then there's certainly some value in getting assessed. Don't forget that these symptoms, even if they are intense, don't mean that you have ADHD, because there are many other conditions that can lead to similar symptoms. The worst thing you could do is probably to begin treatment based on a simple screening instead of a proper assessment by a mental health professional.